Subscribe now and press the bell icon. Never miss an update.
We have our friend and colleague from Russia, Ruslan Isaev, and he will talk about a project, a program that they have, they run there with adolescents, with teenagers. Please. Yes.
Hello, everybody. Good evening already. First of all, I would like to say thank you very much for organizers for finding the free slot for my presentation. I would like to speak about research. This is a cooperation between Clinic of Dr. Isaev. This is the organization of mine and my partners, and also Institute of Psychiatry by Serbsky from Moscow. This is the #1 psychiatry institute inside Russia. Now it's 5 TCs and 1 clinic, detox, totally 160 beds, which work together. We started 16 years ago with two my partners, and in the beginning it named Independence, but this name was too much popular in Russia, so my partners persuaded me after 5 years of working to change the name into Clinic of Dr. Isaev. So it seems very different from other organizations. So let's continue about the research. The name is impact of different groups of adverse factors on the addiction. So this is a free short research which related. The first part was about external factors, external adverse factors. The second one, this is intrafamiliar factors, so named adverse childhood experience. And the last one, consequences of these factors. This is some symptoms which we can watch in the reality in TC. It was conducted on 100 residents of our TCs. The most big part was adverse childhood experience, was named adverse childhood experience. Why? Because it's very important. ACE increases risk of alcohol and drug use and dependence in 7-10 times. I found such data in one of Lancet magazine. What means adverse childhood experience? It includes emotional, physical and sexual abuse, also emotional and physical neglect, and some family dysfunctions like alcohol using, parental separation, divorce, imprisonment of some family member, etc. So let me come back to the first part. This is so named external factors. So you can see a panel. I don't need to repeat all scale. So I'd like to pay your attention on the first one. This is participation in fights and witness the fight. It's about half of all residents. These points like forced relocation and destruction of housing, it's rather little, but we estimate it's not included data of 2022. We estimate the data in the future or this year will be grow because of this conflict, military conflict. This is gender aspects of measuring adverse factors. We can see, so we found at least one adverse factors with in 92% of all residents. The main score for all clients was 3 point, and that means that each of them met at least three adverse factors in their life. But also we found the differences between male and female. ACS score for female was 4.17, but for male only 2.66. In this slide you can see also a big panel of different adverse childhood experience factors. I would ask to pay your attention on the third scale. It's very prominent. There's a big difference in the factor of sexual abuse between male and female. The rate different in 4 times. And also the scale number 8, alcohol and drug abuse by family members. It's you can see, so it's also high, 67 for female and 58 for male. This is the picture about violence. The first one about witnessing violence. So about 2/3 of all residents was witness of violence, verbal and physical. This also about violence, but towards children and adolescents. So you can see also a big part, 1/3 of whole residents met these violence. This is some more dates about the residents. The most prominent, the age. You can see more than half of all residents had the age not more than 18. This is a big problem. So every year we can see the middle age gonna down every year. Of addicted people. And about the substance, the number 1 is alcohol, and also psychostimulants also important. Here we measured dependence severity by 5-item dependence severity scale. About 2/3 had severe symptoms, 1/3 medium, and just 5% low. On the right half, we can see depression. Depression screening was conducted by 9-item scale. There were 9% of residents with severe and 29 with medium depression symptoms. Here we can see screening for anxiety. There were 7% of residents with severe anxiety symptoms and 22 medium. About conclusions and recommendations, of course we understand and we're going to share these findings with our residents, with their family, to give them a more deep understanding what's the root of their problem, and also share with all colleagues. Try to focus on female needs. So you could see on one slide they suffer from violence much harder. And modify our working to use some specific tools for working with trauma also. And we're going to continue our research in the future and modify it and try to measure, especially for teenagers. It's very, very acute problem. This is a recommendation, a conclusion for professionals, and also it's not written here, but we also try to communicate with government to give them some recommendation about how to prevent violence, to establish more shelters, special buildings for women in crisis. Also, the last recommendation for government, I don't know for developing countries, but I know I'm not sure about developed countries, but for developing countries, they should modify their field of justice in terms of just to make this field more criminalized in terms of violence towards female. This is the end. Thank you so much.